pleasure to introduce today's speaker, Dr. Daniel Carey. He was appointed Secretary of Health and Human Resources by Governor Northam in January of 2018. I'm sure had no idea he would be doing what he is today, but he worked as a cardiologist and served as Senior Vice President and Chief Medical Officer at Centra in Hospital 3 in Lynchburg, 3 hospitals in Lynchburg, where his responsibilities included information technology services, patient quality, safety efforts, performance improvement initiatives, and functions of the medical staff. He has a special interest in medical leadership. In addition to his roles at Centra, has served as president of the Lynchburg Academy of Medicine, the Medical Society of Virginia, and the MSV Foundation. He's a longtime Virginia resident, graduated from the University of Virginia and then Harvard Medical School, and he served for 15 years in the U.S. Air Force in active duty and reserve status, earning the rank of major. He currently resides in Richmond with his wife, Kim, who's a registered nurse, and in his spare time, he's at the gym. So, the Honorable Daniel Carey.
Well, thank you so much, Stan, and thank you, everyone. First of all, can everyone hear me okay?
Yes.
Good. And then I'm tempted just to say in closing, how are we doing? We originally planned on 20 minutes of comments and 10 minutes of questions. Is that still our plan?
We can still do that.
Nancy is shaking her head. So thank you very much. And so thank you so much, Stan, for inviting me. Thank you, Nancy, for making the connection. Maybe there'll be a poll at the end of the talk today to see whether that was a good connection or not. I'll let you all decide. And I know we've got distinguished members of the General Assembly. I can see Senator Hashmi, and I also saw Delegate Willett and all of those that were previously mentioned. So I too have some lived experience, and I know that this group has a great deal of experience, whether in the business world as entrepreneurs or whether being social entrepreneurs, a lot of creativity, and also ready for what's happening now and also ready for what's happening next. And hopefully some of my comments will resonate. I will comment first on that poll. Very interesting. The three things that, or the things that I gleaned from that poll, first, that a lot of interest in the vaccine. Over half would take it immediately. I think that's pretty good. I hope that holds true, and some have some skepticism as well. You should. We need to see the data. We need to know that they were vetted by the FDA, but a lot of interest in the vaccine and maybe faith in public health and faith in science. So that's a good sign. The second question, what I interpreted from that is lots have been in connection. Either you've tested positive or a family member has tested positive, you know someone who's critically ill, and over a third have been economically impacted. I know my wife was furloughed. She's a nurse, does clinical research, is now doing research on participating in the AstraZeneca trial here in Richmond. But a lot have been affected. And third, and I'm very thankful, lots of small gatherings. Well over half, we're going to have 2 or 5 or less gatherings for Thanksgiving. And again, what I interpret that to mean is that you're listening to, whether it's Dr. Fauci or the Virginia Department of Health or the CDC or your own good sense, that smaller is better this holiday so that we have everyone around the table, as the governor has said, next Thanksgiving and next holiday season. So in the next few minutes, what I want to do, really 3 things. One, give a quick update on where we are with COVID-19, including some information on testing, vaccines, and also the governor's recent modifications of the executive orders. Then talk a little bit about leadership lessons at this, which I consider maybe the halfway point, maybe not the halfway point of this pandemic. So I need to tread lightly because, again, the only enduring aspect of this pandemic for me has been the continued uncertainty.
Bye. And
lastly, maybe talk a little about the leadership model that, through my experience, that I had tried to adhere to, and how that has lined up with the experience helping to lead in this pandemic. So first, an update. this is not over, even as we really have two aspects. The first is that there's an incredible optimism because there are 3, maybe 4 viable vaccines, certainly 3, the Pfizer, the Moderna, and AstraZeneca vaccines on the horizon. On a call representing the governor yesterday afternoon, and we likely will have an EAU approval probably within 2 weeks, and product will be shipped likely within 48 hours of that approval. And we at the Department of Health, together with over 100 community partners on the vaccine distribution group, are ready to go. And that's very exciting. But getting it to 8.5 million Virginians will take a number of months. So that's optimism. On the other side, we've never had more cases. I'm looking at the data from this morning, 2,500 additional cases. And we say cases, and that's people, that's your mom, it could be you, it could be close family members, but additional Virginians that are infected with the virus. Another 33 Virginians have passed away in the last 24-hour reporting period. These are again, often those with multiple chronic medical conditions that make them more vulnerable, but not always. We have had a number in Virginia less than age 40 who have passed away, but the vast majority are older with chronic medical conditions, but those who would still be alive today were it not for the infection. And that we also saw yesterday 3,200 cases. So it is real, it is in Virginia. It's worse in Southwest, far Southwest, and near Southwest. That would be Lynchburg, Roanoke is how the departments of health classify that. And we are seeing that our ICUs are filling up at Ballad Health in far Southwest Virginia, but also we're having increased hospitalizations, and we're at near the highest level, not quite to the highest level as we saw in May around the healthcare systems in Virginia. So this is real, and we are likely to see, frankly, challenging times that we will only get through together in the next 2 months, even as we start the definitive preventive measures, being a vaccine to achieve immunity through vaccination as opposed through infection. So I think what else would I like to share? As we look around the state, there is significant testing available. We went from really no testing in Virginia to struggles with our testing, trying to get resources. We were partly accounted for because that we were not one of the first states. So lots of resources, reagents, infrastructure went to other states before us, and that created some challenge in us getting resources. So we had backlogs early on. But we are in a place where some days 35,000 tests are being done in Virginia. At PCR, the definitive PCR testing. So in addition, we've distributed in the last 2 weeks hundreds of thousands of point of care antigen tests to higher ed, to local health departments to work with K through 12 education, as well as beginning to be distributed to critical infrastructure. And also over 100,000 distributed to health systems to start systematic testing in addition to what's already been going on of their population. So we are in a very different place. If you have concerns, if you think you were exposed, we have resources. Call your healthcare provider, call your local pharmacy that many have testing. Look on the VDH website, multiple community testing events around the Commonwealth, thousands and thousands per week available for those who don't get it through their normal healthcare provision. So I think that I will talk a little bit about the 4 things that changed essentially with the rise in cases in Virginia, particularly in Southwest, but really everywhere in Virginia. And by the way, we don't start from a bad place. As of this morning, we are the 4th lowest state in terms of incidence per 100,000 per day of new infections. We're the 4th lowest state in the country, but that doesn't mean that we're not rising. It doesn't mean that our healthcare systems may be taxed. It doesn't mean that we don't need to have our guard up. In fact, we do. And those basic 4 things, wearing a mask when you're in public or you're mixing households, even with 1 or 2 people, keeping your 6-foot distance, vigilant hand hygiene with hand sanitizer. You know, in the clinical world, you go into a patient's room, you wash in and you wash out. And I know in our circle here at the Patrick Henry building, if you go to a meeting, you sanitize your hands at the beginning of the meeting and you sanitize your hands at the end. There aren't many person-to-person meetings, but there still are a few. And then if you're sick, stay home. So what were those 4 changes that the governor implemented? First was the gathering size, indoor and outdoor, reduced from 250 to 25. And why was that? Well, based on our incidents, we looked at it with the UVA Biocomplexity Center, that the chances of being with an infected individual, whether they were symptomatic or asymptomatic, based on the numbers, there was a big break going from 50 to going to 25. And that's where we chose, and we thought that was achievable. And in reality, we needed to be much smaller than that. Also, by the way, it does not apply to religious services, which is happy to talk about in the questions. We want our religious communities, our faith communities, to use social distancing for gosh sakes, because that's how we prevent the infection. And a number, really 2 places that we're hearing from our contact tracers and our health departments, it's religious services, not maintaining those 4 basic things, and also that's gatherings in homes. It's 2 brothers get together and their kids and their significant others, or families get together for a small celebration. But guess what? 7 or 8 days later, 8 of the 10 people test positive. And that's what we're hearing across the Commonwealth, especially, frankly, in Southwest, where the incidence is highest. We also reduced the mask down to 5. The CDC suggested that even children as young as 2 and 3 can be taught to consistently use masks. And I see that in a preschool around the corner from where I live here in Richmond, that they're lining up and everyone's got a mask, and these kids are 3 and 4 years old. We reduced it to 5 because that was a big step, 10 to 5, but important for childcare and educational settings. We also learned the lesson from Tidewater that consumption of alcohol beyond 10 leads to more and more of that face-to-face interaction that leads to spread. It really is that close contact that is usually face-to-face, lasting 15 minutes within 24 hours. And then all establishments are closed after midnight for food. We don't have bars in Virginia, as you know, but the bar areas in particular are where lots of face-to-face interaction with consumption of alcohol, which I certainly enjoy and hope to use responsibly, but it does lead to reduction of inhibitions, and folks are talking more loudly, talking close together, and we know that leads to spread. And when we implemented this, it appeared to have a significant impact in Tidewater when there was a spike there in July, August timeframe. And then there was essential businesses that we need to do all of those preventive measures in the DOLE guidelines, et cetera. So those are the 4 big changes. So again, it's the basics done well that's going to get us through that. I think in the interest of time, we've used a lot of our CARES Act dollars in childcare and vaccine education. An important platform called Unite Us we've invested in order to connect social services and services beyond healthcare to individuals who are struggling. That will be an important platform going forward, both for hospitals, for social service centers, for our AAAs, as we try to provide services to the most vulnerable during the pandemic and afterwards. I did mention a little bit about the vaccine, the Moderna, the Pfizer will probably be first, which does require the deep freeze, and we've got those logistics worked out with 15 health systems that have the -75, -80 degrees Celsius that will be required. You don't need quite the same deep freeze for the Moderna product, and AstraZeneca product is simple refrigeration. And those are all 2-dose, and we expect those to be in limited quantity distributed in Virginia. And again, the priority list comes partly from the federal government and the CDC, partly implemented and interpreted by the state with lots of input. We want first, it's those that are caring for those that have COVID. So it's healthcare workers, first responders, writ broadly. It could be adult service workers that are in the contact with public that may have and definitely have COVID-19. but then it's vulnerable populations, both the elderly and in congregate care settings, but also those that are in communities that are vulnerable, that we've seen that have been particularly vulnerable to this pandemic. So what are those lessons that I have observed going through the last 9 months working on this? And I'll just summarize. First, this is not a hurricane. And a lot of our emergency management and how we do kind of a response to emergency is based on a relatively rapid, serious emergency that you need directives from above, you need top-down management to affect action. And that is why we have a unified command, and it depends on what the emergency is as to which agencies or which secretariats take the lead. In this case, it was public safety and health and human resources. Secretary Moran and myself on behalf of the governor. But at the same time, this is prolonged. Usually those are over in 2 weeks, and the recovery may take months or even years, but it's pretty straightforward, the time course. And in this pandemic, with prolonged uncertainty, we've really had to meld both the emergency management structure, but also we had to connect it to the normal decision-making process of proposing budget amendments, working with the General Assembly over months. So that has been a challenge, and I think finally we're, over the last month or two with the special session, been hitting stride on how to meld those two things. Second, leadership makes a difference. The simple messages that the governor has been emphasizing of those 4 behaviors, and that we're in this together, and it does, in the end, depend on our ability to connect with our neighbor, connect with our loved ones. It's not only about ourselves and our desire to do what we want to do when we want to do it. There is a common good here, and that we have to, in order to get through this better, we need to do some basic things that are maybe the biggest act of response, of responsible living, and responsible not only to ourselves, but to our loved ones and our neighbors. And I think the governor has done a great job with that. And I think, unfortunately, at the national level, we have not had consistent messaging about the value of testing, the value of masking, the value of social distancing, and how to balance. Yes, we need businesses to be in place to provide essential services, but we need to have those businesses and schools and other things open in a way that doesn't promote spread of the virus. The third point that I think is a lesson that I continue to learn is trust in government and institutions. I do think with the politicization at the national level of the CDC and the FDA, for example, that, and frankly, science being called into question, that's not going to change with a change in administration. That is going to take, I think, a decade to repair. We've got to understand there are not alternative facts. There are facts. And in science in particular, there is data, there is a hypothesis. It is testable and verifiable. And the CDC, for example, and the FDA were considered the pillars, not just in this country, but around the world, for objective, evidence-based public policy and decision-making bodies. And that has been eroded. And I think that it's going to take a long time to repair that. And I think that trust in our institutions, they've got to trust but verify. They got to show us data. They've got to show us through transparency their processes and the why that they're recommending what they're recommending. But I think civil society depends on faith in institutions. And if your political mindset is to blow up institutions, that undermines civil society going forward. And I think that is dangerous to our democracy. And I'll just say it as plainly as that. And I will say, from a leadership perspective, I have benefited from a lot of great mentors. And I'll mention one. Greg Hebert is my coach. He wrote a book, You Can't Give What You Don't Have. I would recommend it. You can get it on Amazon. But Greg has been my coach. He was my organization's coach. Really, I've had interaction with him for the last 6 years. And I'd kind of drifted away and had more of a friendship. But in the middle of this pandemic, I realized I needed my coach again. And I established a formal relationship again. And Greg talks about, H-A-V-E, humility, leaders. And I'm talking to a group of leaders who have accomplished a great deal and are ready to continue to accomplish and contribute, and also maybe are thinking about what that next move might be. A is acceptance. It means that everyone's not going to agree with you, but you don't need to question their motives, and you need to listen deeply in true dialogue. V is vulnerability, that we are not perfect. Leaders make mistakes. Government leaders, I would do things differently. We could talk about testing and tracing and a number of things that we're not perfect. And with a novel situations, we will not do the perfect thing first. And that's okay, as long as we're continuously improving and learning. And then E, empathy. Empathy for the people we serve, the people who have contracted the virus. Empathy for those who frankly don't agree with us. Empathy for the frontline workers. Empathy, frankly, for our leaders and the weight that they have, whether our General Assembly members here, for the governor, for our national leaders, for the president. Empathy for the pressure and uncertainty that they're dealing with. And I'll just give a couple of examples of that. In terms of humility, I'll tell you, I may be like Neville Chamberlain, I think, it wasn't Neville Chamberlain, but it was Winston Churchill, I think, speaking of Neville Chamberlain, who's a humble man with every reason to be humble. Going into this pandemic, we knew it was coming. It was a tidal wave coming. Everything was new. Who would have thought that suddenly we were in the papers being criticized for how we were reporting the number of tests done, when never, ever in any pandemic or in any medical situation do we publicly disclose or really care about the testing capacity. But that was a whole new thing that we had to get right. And we did combine antigen results with antibody testing and with PCR testing, because that was a measure of total testing capacity. But ended up having one of my Harvard professors vilifying me and our decision in Virginia in the Atlantic Monthly. So that was a relative low point. But stay humble, but constantly learning. And the acceptance part, there are a lot of people that disagree, but you've got to listen, because often there's a nugget of what people share. And it is incredible what you can, I have found that my most, it is ironic because I'm talking, giving an address, but I think your most powerful leadership behavior is listening deeply to others and truly understanding them. One, you may learn something. Two, you may modify what you're doing because of that. And three, it's building that relationship of trust that's so critically important, regardless of what the next step might be. And in terms of that vulnerability, leaders are not supposed to be perfect. And my gosh, we have to admit when we made a mistake, or admit when we've lost, for example. I will say that for me, I got burned out. And after giving the governor a briefing every morning for 12 or 13 weeks in a row, lots of support from Commissioner Oliver and the team at VDH, but a lot of getting in at 4:30 and 5 in the morning every morning. And I exercise every day, but I stopped, and that really threw me off. And I needed to turn to help. And I got and frankly, I said, hey, I need a couple of days off here. I need to reframe this and get some exercise. And the chief of staff, I'm very, very appreciative of him saying, Dan, you've been giving us positive energy for 12 weeks. Let us help you. And I will say that leaders, knowing when we need to ask for help, whether it's, hey, I don't understand this problem, I need help to find a solution, or hey, I need a little break here. I need to have a long weekend and kind of disconnect for a little while, and I'll come back swinging next week, which was my experience. But I think we need help from the folks we report to. We need help from our peers. We need help from our direct reports. And knowing that the leader is open to that is a critically important thing. And then empathy, of course, we've got to be able to identify, especially with the people we serve. From your survey, over 30 or 40%, I think, were greatly affected economically by the pandemic. And we realize every single time we make a policy adjustment, there is an economic impact. And we're not balancing things, because we know that we won't get through the pandemic into a better economic place until we deal with the health issues. But we do know that every time we narrow, the bars and restaurants at 10 o'clock, that has an impact. And we definitely understand that and want to unrestrict that as quickly as we possibly and safely can. So I'll come to an end now and make sure that Nancy's nodding her head. So we're ready for questions. But it's maybe not common or fashionable to end with a short poem, but I will, because I think we all need our inspiration, and we take it from a variety of places. And one of my favorite poems is particularly apropos, from Wendell Berry, and it's called The Real Work. And I think as we face so much uncertainty, even today, that I think this is important to remember. And maybe as you think about where you are with your business or where your next opportunity, this will resonate. So The Real Work by Wendell Berry. It may be that when we no longer know what to do, we have come to our real work. And that when we no longer know which way to go, we have come to our real journey. The mind that is not baffled is not employed. The impeded stream is the one that sings. So I think I'm so grateful to be serving the Commonwealth and this administration and the governor. And I'm particularly grateful to be able to serve at this time that's so challenging, but also so meaningful to me personally and to the Commonwealth. It is truly a privilege. And thank you all for your attention, and happy to answer any of your questions today.
Thank you, Secretary Carey, and thank you for both the leadership lessons and your insights on the COVID situation. And I just want to say that all the executive coaches in this room are very delighted for your shout out for coaching. So you did help the economy right there, I think. The questions have come in, and a lot of them center in two different areas, both in areas around children and also the vaccine. So if I might start in the vaccine area. So there are multiple vaccines, and how is it going to be determined what you should have? And do you need an antibody test to see if you need a vaccine? Can you explain what you know about when more folks are eligible to get it, who should be getting it, and which vaccine? These questions come from Jay and Bo.
Sure. Well, thank you for that question. First of all, we have not received guidance on what to do about those who have been infected, and whether we do not anticipate that antibody testing to see if you've been exposed is the requirement before you get a vaccine. But those exact details have not been released. That's part of what is, you got to know the protocol that they used, and you need to make sure that when you generalize from a test population and a experimental protocol, these are randomized, double-blind controlled trials. Most of them had two out of three people, two would get active vaccine, one would get placebo. Undoubtedly, they tested antibodies initially, but I don't think that was a requirement. But we will understand in the next few weeks, we will have instructions, because obviously probably 7 or 8% of Virginians have likely been infected. And do they need a vaccine? Is it safe to get a vaccine? And I don't think that they did pre-screening that if you had antibodies, you didn't get the vaccine. I think if you had known diagnosed illness, you didn't get the vaccine. But again, we don't know those details of the 3 phase 3 clinical trials. So exactly how to generalize that, we can't tell you that now. We will say this, is that you need to get, again, the good news is the 3 vaccines are all reporting, measles vaccines level of efficacy. So that's over 90%. So at a little less so in the AstraZeneca, but then there's some other data that looks like it may be as high as 90% there as well, in addition to the Moderna and the Pfizer vaccine. So what's available may determine what you get. And I haven't seen the data, but presumably if they all go through even over the next 2 weeks, a fairly vigorous and rigorous evaluation, and they make it through to get their emergency use authorization, I personally think I would get whatever was available. You need to make sure you get the same second dose, and the logistics coming from the Department of Defense and McKesson distributing to locations throughout the country will do a shipment 3 weeks later if the protocol is 3 weeks later to get the same vaccine to the same locations, and one of them is 4 weeks. There'll be identical shipment 4 weeks later. So it's a little early to know, and I wouldn't game it. I think that right now we need to learn more, and we're not able to answer specifically that question, except you're going to need to get the same second dose, because some of them are RNA-based vaccines. Some of them are protein-based vaccines. They work very differently, so that you need to make sure you get the same exact vaccine. And that logistically will be a challenge, and we're going to meet that challenge, but we're all going to have to pay attention, both the consumer / patient / resident of Virginia, as well as all the centers that are part of the vaccine. So I think that was one of the questions. Nancy, I may have missed one.
You got it. Thank you. A number of the questions were related to that we're learning that more cases of kids are getting sick nationally. So is that true in Virginia? And is that related to in-person school? And if that's a contributor, do you have an opinion on the many disparate ways in which school districts are handling this?
So first question was, do I think that, well, we definitely are seeing across the country. I'd have to look at the demographics. The biggest jump is in the 20 to 39 group. The 20-year-olds and 30-year-olds are the much bigger group of who has been infected in Virginia. Nationally, and again, we're the fourth lowest. So what happens in other places tends to be what we see 3 or 4 or 6 weeks later. So we are getting reports that children are becoming infected more than we thought, and they're becoming symptomatic more often than we thought. So I do think that that's to acknowledge that kids don't get kids aren't immune from this, and they likely do get it less. They likely have less viral load when they do get infected, which is a good thing. Now back to the school question, and we have this on the VDH website. You can look at every outbreak in every school. You're much more likely, it's out in the community. I mean, that's where it is. And so whether it's teachers or children are getting it in the community, and they're showing up at school if they do have face-to-face schooling with it, as opposed to getting it at school. We need to look at the mode of transmission, and there are some outbreaks, and it's often just like it was in the poultry and meatpacking plants way back earlier in the pandemic, that it's hard to tell where it came from. Was it transmitted at the work site or the very close congregate settings in which the workers are living, with multiple family members working in multiple plants, and very complex from an epidemiological perspective. So in terms of very little transmission is happening in the schools. There are cases in the schools, and most of that is coming from outside, and people are showing up at school. We've made a policy decision, given that especially early on, and still today, in far Southwest, incidence of 45 new infected people per 100,000 per day, as opposed to maybe 15 or 16 or 18 in other parts of Virginia. That's a 2 or 3-fold difference. So the risk profile and the recommendations may be different. I do think that we wanted to make sure that with organized data presented, by the way, there's no special place. I go to the public website and look at that data every morning, and it's updated. It's 9 o'clock. One of them updates right around 9, and another one updates right around 10. You can look at it like I look at it, and the data is right there. And our local health directors are working with local school divisions for what makes sense based on the resources, and frankly, there's some change in risk tolerance. So I do think that schools have not. I do think that you can design a classroom, whether it's higher ed or K through 12, in which folks are distant. I think small children, it's hard to keep them distant. If you're a parent or a grandparent, you know that, and it is a challenge. I do think as we have higher and higher rates of infection, in-school education, even with its remote learning, is not nearly as good. We know that, especially for K through 3 and special education courses, it is really, really a challenge. There is a cost, but we are concerned about the number of teachers that are above 60 and above, and staff members at schools that are age 60 and above, and with vulnerability. So I think we've chosen to have not to support our local health directors as well as through VDH with data, and we don't have a exact, we don't have a playbook that tells you exactly the right thing to do. So we shared that degree of uncertainty with school divisions and local health directors, and we're working through as best we can and learning going forward. But I do think what we've seen in the last few weeks is less face-to-face school, not more.
Thank you. Secretary Carey, I know that we're hitting past 9 o'clock,
shoot.
but we still have some good questions. Are you able to stay a few more minutes, or do we need to let you go and serve more people in the Commonwealth?
Well, thank you. I actually have my next thing is 9:30, so I have some flexibility today, but I know we started late and maybe I've run over. So I'll take my cue from you, but I don't have to step off this moment.
Well, we know that some people may have to, but thank you, Dr. Carey. I think I'd like to ask a couple more questions because so many are coming in.
Oh,
and we
glad to.
appreciate your giving us that latitude. So the COVID-Wise app that some folks are using in this process, what's your belief about how worthwhile that is for a higher level of adoption? Can you share your thoughts on that?
Well, yeah, I sure can. Yeah, COVID-Wise is, I'm looking for, I have my work cell phone is here, but my personal cell phone, which is on the other side of the desk, is where I have my COVID-Wise app. It is, we were the first in the country to work with a developer and with Google Cloud to utilize the Google Apple. They don't always work together, but for the pandemic they did. It's not based on knowing where you are. It doesn't keep track of where anyone is, but it can tell through Bluetooth low emission signals of someone is around 6 feet. It can, by the strength of the signal, just like you may have remote, Bluetooth headphones in addition to your listening to your book on tape or Audible or whatever it is, or this program, it can tell by the strength of the signal about how far away it is. So we set it, like many states have, we really set the trend, setting it at 6 feet based on CDC recommendations. And it is able to say, so Dan, you've been around, you don't know who they are, you don't know where it was, but it's keeping track of someone who meets that criteria of 15 minutes within 24 hours, 15 minutes of contact within 6 feet. And it's keeping track of who those folks are, not who they are, but some code of some phone that it could send a message to later on. So if I turn positive today with a test, the VDH will give me a key, and I plug it in and it'll go out to maybe the 10 people that met that criteria. And it won't say, Dan Carey got infected and he may have infected you. It'll say, hey, you've been exposed. Check in with your healthcare provider or your local health department to learn more and whether you should be tested or not. So we were the first in the country. We've had, I think we're over 800,000 downloads. We love it. There were 5 million downloads. So please download COVID-Wise work today. Not during the meeting, but after the meeting. And there was a review in the Washington Post, there was a review in the Atlantic and in the New York Times that we are one of the 2 states, I think Delaware was the other, that really had an adoption that was getting up around 15, 16, 20% of the number of cell phone users or adult cell phone users in the population. So we're not where we want to be, but there is value. And the model says that if you get above about a 10% adoption rate, you start to get real impact. So it wasn't adopted as fast as we wanted it to be, but it's still growing every day. More thousands of people download it, and it definitely has been involved in the contact tracing process. And we're one of the 2 states that objective folks say, hey, it seems to be making a real difference, because we had the numbers adopted that we have. So we're very thankful for that. But please, if you haven't downloaded it, they can't trace it. It's not who you are. It doesn't do geolocation. It's totally about Bluetooth strength of signals, and keeps nothing on your phone.
Excellent. Thank you, Secretary Carey. And I think related to a more immediate need, by the way, I think Gary's noting that on his gadgets for geezers list now, so it should get more ripples after today. How are we doing with PPE and other things for our frontline workers?
Right. Well, I think that the supply chains for PPE have dramatically improved. Are they where we want them to be? No. I think our health systems are, they have the financial wherewithal to stockpile. And talking to the CEOs on the Commonwealth, whether it's Nova, Ballot, or Centra, or Centera, or Nova, I think I mentioned that, or the academic medical centers, they feel like through two mechanisms. One, they've stockpiled, and 2, they've learned how to reduce the burn rate by about 80%. And that is through trial and error of who really needs to use an N95, and that is, I won't say risky business, but that takes even in emergencies, you have to do altered standards of care in order to see what works, because we didn't have supply. So we've learned a lot in the last 9 months on how to keep our healthcare workers safe. However, and we've worked with our primary care community, the cost remains an issue. It's 3 and 4 and 5 times and 10 times more expensive. And some frontline workers, if they're independent contractors, simply can't afford it. So that was one of the things that we did through Medicaid, is so frontline workers who serve, for example, the developmentally disabled community in the home, that to distribute PPE, mostly facial coverings, gloves, and gowns, and face shields. So I think that situation is better, but I think cost remains an issue, and it's not back to normal by any means, just because demand is going up, and we may have a second round of shortages, and where we have some stockpiled, but the state is the supplier of last resort, not first resort, just because of the capacity.
Great. Secretary Carey, I so appreciate your willingness to share leadership lessons, updated information on the COVID world, and know how busy your day is. Thank you for the extra time. And I'm going to pitch it back to Stan to wrap us up.
And thanks so much. I will sign off, but thank you so much. What a distinguished group you have, and what a pleasure it was to spend time with you all today. Stay safe. And as your survey indicated, keep it small, keep a distance, but still connect. That's so important now more than ever. Thanks so much. Bye-bye now.
Stan, you're muted.
Okay, again, thank you very much, everybody, for coming and for putting up with the glitch in the beginning. I apologize, and we will work on that. And you can tell your friends that missed it that we will be on, we'll have the video up soon, and I will send them a note too. So thank you very much. We'll see you again in December on the 22nd. Thanks, everybody.
Thank you.
Thank you.